Hi there, and good afternoon. We are working together to save our families, our communities, and our way of life. Thanks for watching Canceling COVID. I'm Tanya Riven. So glad to have you join us on this Friday afternoon. We want to say thank you to our sponsors, Mecklenburg County Public Health, mecnc.gov, and Groundwater Solutions for their support. Both are available to offer information for you. You can see Mecklenburg County Health go to their go-to for your COVID-19 questions. Again, mecnc.gov or 980-314-9400. Well, it's so good to have you with us. And it seems like the more we close the racial gap in vaccination rates, the more lives we can save. Those words from President Biden as he visited Raleigh on yesterday to push his vaccination campaign. And quite a few people were there that I knew of, and they were very pleased with what they heard. He's now asking people around the country to go door to door this weekend and talk to their neighbors about getting vaccinated. It's really important that you talk to others and have the conversation. I had a conversation yesterday to try to answer the questions. And of course, that brings us to the question of the day. What else can we do to encourage community members to get vaccinated? What is it going to take? A lot of times it's just having the conversation and trying to answer some of their questions. So I had a conversation with a senior the other day, and she was saying, well, what about, that they're saying there's a chip in there? Well, what about this and what about that? And I was doing the best that I could, to answer the questions that she had. But the fact that she was asking questions, I think was what I really could appreciate instead of just taking it from a website or from social media or just from talking to people in the community. Because again, she was an elder and, she was asking me all these questions and I was trying to refer her to where she could get valuable resource information, but also just sharing what you shared with me and what has been shared from my experts that's been on air. So again, what do you think about that? The question of the day, again, is what else can we do to encourage members of our community to get vaccinated? You're pretty creative and pretty thoughtful, so I'd love to hear your thoughts on that. The COVID-19 pandemic has dealt a significant blow to life expectancy in the United States. According to new research, American life expectancy dropped by just 1 year in 2020, but more than 3 years has been shaved off the life expectancy for Hispanics. And get this, almost 2 years for African Americans. And this is a conversation that we had tried to have before because it's fairly shocking. It's like we're always on the short end. And here we go again. 2 years as a result from last year and this pandemic, the life expectancy rate has dropped. And we're at 2 years. So I've got someone who's going to come and join us to talk more about this, Duane Reynolds, Just Health Collective. And he's going to deal with the truth of how COVID has shined a spotlight on health outcomes are not equal for everyone. And this is the nasty, nasty truth. Some information that we certainly don't want to embrace, but certainly need to discuss. So I welcome you, Mr. Duane Reynolds from Just Health Collective. Good afternoon, and thanks for joining us.
Good afternoon, Tanya, and thank you for having me on your show. Very excited to be here with you.
Oh, awesome. So are you surprised by those numbers when you hear them? What comes to mind when I share those statistics?
I wish I could say that I'm surprised, but I'm not. And the reason that I'm not surprised is because I understand and know about the social determinants of health, which are really the economic and social conditions that ultimately influence a person's health and health status. And unfortunately, due to a multitude of things, but in particular systemic racism, communities of color have been affected by social determinants of health for many years. And until we address those root causes, we will suffer disproportionate impact, such as what we're seeing today with life expectancy and still COVID death rates.
So Just Health is focused on building a healthcare system that's fair, impartial, and representative of the community. How are you guys going about this?
Well, we are a consulting and advisory services firm. So we work with healthcare organizations really across the healthcare ecosystem, anything from hospitals, health systems, health plans, health technology companies. And we try to help them understand one, about their own internal culture around diversity, equity, and inclusion, and what they can be doing to transform it, to become more inclusive and equitable. But the second piece of that with healthcare organizations is that they need to be focused on health equity, which is ensuring that there is equitable care delivered and equitable outcomes received by the folks and consumers that are interacting with their system. So, we really coach and guide them through that process.
So how receptive have these companies been to this conversation?
Interestingly enough, post-pandemic and post-social unrest, we have seen major interest from organizations at a CEO and governance level.
Mm-hmm.
This is definitely here to stay. Prior to, there certainly were organizations across the country that were doing this work, but by and large, there were still organizations that hadn't yet embarked upon it. But now I think it's seen as a strategic priority in many healthcare organizations.
So you guys are kind of like this is a visionary and coming up with this. How long have you been at this, and where did the whole idea come from?
Thank you for that question. So Just Health Collective, believe it or not, started in March of 2020. So I had
During the
been,
pandemic.
yeah, absolutely. I had been gearing up to start the company since January of 2020. And it was one of those things where I said, this is a passion of mine. This is how I feel like I'm going to impact the healthcare industry. And it was important for me to go ahead and proceed. And, because of the things that happened again, we have not slowed down in terms of work and opportunity for us to change. Just Health Collective came about really because of my past history and experience. So I have a master's degree in health administration. I have been in healthcare for over 20 years, worked in academic medical centers running faculty practices, and really got to see firsthand how the difference of experience outcomes were for communities of color, and have always known that I wanted to impact that in a different way. So I would say probably about 5 to 6 years ago, the seeds of Just Health Collective were born. I was working for a consulting organization and actually created a practice called the Inclusion and Health Equity Practice. So that was really foundational to what today is Just Health Collective.
And thank you for that. It's so important that we give back and serve others, and obviously that's where your heart is. And to hear how much experience you have in the health administration and just health workers and working with health really speaks to your passion. You mentioned earlier that companies are being more receptive. What has the demand been like? Because certainly you say it's going to be around, it's here to stay. So what type of spike have you seen?
Well, year over year for us, we're going to see 100% growth. And our pipeline is pretty heavy without really doing a lot of marketing. I do a lot of public speaking, so that certainly helps, but we have not really done a lot of marketing, and it's now a lot of word of mouth. But organizations are really confused about where to start, how to start, what they should be talking about. The reality is that most healthcare organizations are still run by white males. And so, they're at a point where they don't quite understand what they need to be doing and really need support from organizations such as ours.
So I see Frederick Ratchford has hopped on. Good afternoon, Frederick. And we'd love for you to weigh in on the question of the day. And it's like everyone is trying to get creative to encourage more people to get vaccinated. So, Frederick, if you don't mind answering, what else can be done to encourage community members to get vaccinated? Because, boy, are they trying. So many here in North Carolina just pulled the winner for the first $1 million from the lottery. I didn't get the phone call, so who knows? But, they're going to do 4 of them. And I just think that's great, to give people an opportunity to win $1 million. But I don't know if it's moving the needle or not, Mr. Reynolds, on whether people, will go ahead and get vaccinated. But let's talk again about what you guys are doing. If nothing is done to address health disparities, what do you foresee the danger in this?
Well, the reality is we'll continue along the path that we're on, which is not a path that is is sustainable or one that is good for communities of color or other marginalized communities. There are approximately 83,000 lives of Black and Brown people that are lost each year due to health disparities.
Mm.
And it's estimated there are approximately $57 billion that are lost annually to health disparities. And as we already know, our healthcare system is more expensive than any other healthcare system in the world. And
Right.
so we have to go on a different path. The demographics of our country are continuing to shift towards majority minority. And
Mm-hmm.
so if we don't do something about this, our healthcare system will continue to really plague our economy, and people will continue to suffer poorer outcomes.
There are only a few businesses that seem to be able to continue and not really perform or not really meet the requirements for the public, and
Mhm.
still there is no or very little accountability to get it there. I think people have an idea of how to fix the system, but just getting it to the goalposts, I think, seems to be one of the biggest challenges, because when you look at the numbers, when you share what you share, and certainly we know that our system is fractured, is really broken. You just kind of hobble through and hope for the best, which is not a good rate. That's not a good business plan for anybody. Certainly not a good way to operate a country.
That's right. And I think, there are some shifts that are happening. So a move towards value-based care where organizations are paid based off of the outcomes and reductions in cost and improvement in experience. That has been pushed by the Centers for Medicaid and Medicare Services. So it's ongoing, and ultimately we hope that more of our healthcare organizations are under value-based care contracts. I also think that there's a lot of disruption that is happening in the industry as a result of health technology companies. So, the typical players, if they don't change the game and pull it together, then they're going to be disrupted by more innovative and technology focused companies that can help accelerate some of the changes that are necessary.
Wow, thanks for sharing that. Let's shift now and talk about vaccinations. I kind of mentioned, the drive to encourage people to get vaccinated, and trying to get creative with ideas. Of course, your website is just healthcollective.com, but there's a thought that people of color are more likely to get the COVID-19 vaccine if the provider is another person of color. How does this play into some of the diversity discussions that you all are having?
We absolutely understand and discuss that with our clients. The concept is known as patient provider concordance, which basically says that if a patient and a provider's racial or ethnic background matches, that they are more likely to adhere to care plans, to seek preventive care, and ultimately to have a better experience. And that has to do with trust.
Yeah.
And so hopefully that has impact on, one's thought about getting vaccinated.
Well, I smile because there's actually a word for that. That's why I was like,
Yes, there is. There is.
oh gosh, concordance. Okay. So that's interesting that people are aware of that, but it does make sense because you kind of see someone that looks like you and you feel like, well, I can trust them. Obviously, they can relate and they understand. And that has been one of the challenges that we have had, is sometimes the bedside manner, or there's also documented where some of the medical professionals can't quite relate or aren't able to understand where someone of color, what they're dealing with, and how to articulate that, or just understanding the lifestyle and the demands, and that is asking a lot. So as we wrap things up, are there any other tidbits or any other information that you would like to share?
Yeah, I would just encourage everyone on a personal level to think about health equity, because the reality is this has been around for a long time, and we have been impacted for quite some time. It has been, I would say, quiet kept in terms of, healthcare organizations sharing data and helping us understand that these challenges exist. But now is the time to get involved, from an advocacy perspective, from understanding policy decisions that ultimately will impact health. And we deserve to be able to, go to an organization that we know is going to treat us equitably, and we're going to have good experiences and equitable outcomes.
So, Mr. Reynolds, you guys, I would think that you operate all around the country. If
We
somebody
do.
is, yeah, one of the things I think that a lot of people in our community, the average person doesn't even understand how the health industry works when it comes to the profession and the providers. And, I just had an experience, and I know I said I was going to wrap things up, but I thought about this, which would be helpful for so many people. My mom, who is now 85, and she had the same old doctor for years, and the doctor decided to leave one practice and go with another company,
Mhm.
and she couldn't find her. And if you can imagine, for someone in their 80s, that was very traumatic for her, trying to find someone else to build a relationship with. And it was very tough because 2 years earlier she had had a heart surgery. So we finally found the lady, and that practice shut down. And this is all localized right here in the Charlotte area. The company was out of Tennessee. But about a month later, we found her again. And I was like, this is so crazy in our country. You're having to chase and find a doctor that you had a relationship with. And so I think oftentimes people are just discouraged from the business side. You find someone you build a good relationship with, and then there's some type of change. And so now you got to find someone else. And of course, that's just the business of it, obviously.
Yes, but it is unfortunate. There are a lot of things that are administratively burdensome to consumers, and even the understanding and concept of how to move through billing, why you might get separate bills from a physician versus the hospital. So it's complex, and one of the things that we have to do in healthcare is to simplify, because our consumers really need to understand it in order to be able to make good health decisions. And it is upon us to really try and make the process more simple and seamless for people to move through.
So what is it like as far as the healthcare industry? What are the numbers like? I mean, for these people, so like here in Charlotte, everyone's familiar with Atrium Health and
Mhm.
Novant. After that, I think even I would get lost. Besides the small medical practices, are you involved with all different sizes, shapes, and sizes, or is it mostly the big guys that are calling on you?
We are involved with all different shapes and sizes, from medical practices that may have as little as 10 doctors to multi-hospital health systems. So we really serve the spectrum, because the reality is health equity weaves through each and every healthcare organization, so they all can benefit from having some coaching to help them transform in their process.
Do you find if you had to put a percentage, or even if you had an idea of how many minority-owned medical groups are around?
That would be a very small percentage.
Yeah.
There are not many that I know of. There's one in Chicago that has a couple of group practices, but by and large, we don't own a lot of medical groups or hospitals, which is part of the challenge.
Yeah.
And we probably represent about 11% of CEOs and C-suite executives
Yeah.
in hospitals and health system. And again, that is part of the problem. We need more people who are at the top of these organizations, helping to make strategic decisions, helping to bring that lived experience to the table to be able to create a more equitable healthcare system.
Well, I know someone here that I would love. I'm going to pass your information along. And before I let you go, we had the website, if you could put it back up, but First Care Medical Clinic, and here in Charlotte, and he has about 7 or 8 clinics, and there's a big network of Nigerian professional medical staff or professionals here, and they all have like their own setup. It's usually just one. But
Yes.
I think working to try to work through the system, here I am trying to partner people together, but it certainly couldn't hurt what
Yeah,
is happening.
absolutely. I appreciate that. And what is happening in the field is that there are more specialty demographic based companies that are being created. So, for instance, virtual care for the LGBTQ population, virtual care for women's health, virtual care for the Latinx population. So
Right.
this is starting to happen. And, we as African Americans have opportunity to do the same type of thing and provide more culturally competent and culturally sensitive care to our own populations.
Awesome stuff. So thank you again so much for taking those questions as well. And thank you for taking the time to talk with us. Duane Reynolds, justhealthcollective.com. It's been a pleasure to talk with you, sir.
Thank you so much, Tanya. It's been a pleasure to be on your show.
Oh,
Appreciate it.
absolutely. Great information. That's what we do, guys. We try to keep you informed and give you the information because we're looking for real solutions and we've got real talk. And I think that would be a great connection for him and Dr. Aquara at First Care Medical, just to kind of find out how they can work together to deal with these health disparities and everything that we continuously deal with. A couple of things I wanted to add as of Wednesday, 65% of adults in the country have gotten at least one COVID shot, and 56% are fully vaccinated. So we're making progress, but clearly we are not going to meet the mark. And that's why we have our question of the day. Frederick, I didn't see you answer. I see others hopping on. You're not very chatty today. That's okay. But, what are the ways could we encourage others to get the vaccine? There's got to be something that would really hit that sweet spot to move someone. And I still feel like it's just grassroots conversation, head on, one-on-one, just talking to people, just tapping into just giving them the knowledge so they can have a better idea of what they need to do. North Carolina right now is not quite there, but one of the things that I saw, and I appreciate my producer, she's so good at what she does. In addition to a shot at $1 million in North Carolina, now you've got a shot at trying to get a free flight. That's correct. North Carolina is behind the average right now. 52% are fully vaccinated and 55% have received one dose, but you can try for a free flight. American Airlines has gotten in on the incentive. So if you get vaccinated, it's a chance to win a flight anywhere American Airlines flies. And that's pretty good. Of course, there probably may be some restrictions, but you would need to get vaccinated. So let's see, you've got a shot at some money, a shot at some cash, and now a shot at a flight for everyone. So something to keep in mind again as these numbers are trying to improve, because as you can see scrolling across the bottom, this Delta variant that everyone's been waiting for, knowing that it was going to hit us here in this country. Well, it's headed this way. And that's what really has a lot of people alarmed. You've heard Dr. Fauci talk about it, and the U.S. Surgeon General is putting information out about it. So, just take notice, folks. We've got to make sure that we understand the pandemic is not over. So anyone who gets a COVID-19 vaccine or shows proof of vaccination when they are going out to the Summer Stock Charlotte Festival on Sunday, you're entered to win tickets. Again, that's for a free flight. But there's also, as I stated, American Airlines has partnered with the state and the county for an opportunity for you to win tickets. That festival is from noon to 4 at Camp Green Park. There's also the COVID vaccination clinic that's going to be at Little Rock Amy Zion at 401 North McDowell Street. That's on tomorrow as well. So that's another opportunity for you to get vaccinated. It will certainly get you entered into the opportunity to win $1 million. And then on Sunday at Smithville Park, it's called Salute Smithville, but it's also a COVID-19 and vaccination clinic. I hadn't seen any of you weigh in on the question, what else can we do to encourage others? President Biden is suggesting that you go door to door and hold conversations and, talk with your neighbors. And maybe some people just don't feel comfortable holding that conversation, but certainly our sponsors are experts that can help you. Mecklenburg County Public Health, MECCountync.gov is one, and Groundwater Solutions is another. I appreciate you all hopping on with us. It's time to wrap things up. I want to say, as always, life's challenges make you better, not bitter. You can join me on this Sunday, Sounds of Inspiration. We kick off at 7 a.m. for inspiration and information. And it's always great to talk to you, always great to hear from you. So hopefully you'll hop on Streets 103.3 and 100.9. Excuse me. Make sure you have a great rest of the day. Enjoy your weekend. Stay safe. And thanks for tuning in to Canceling COVID. We're going to keep working at this, bringing you real solutions and real talk. Have a great day, everyone.